Vasculitis is a rare, potentially life-threatening disorder in which the body's own immune system attacks healthy tissues and cells, causing inflammation of the blood vessels. This inflammation deprives affected tissues and organs of blood supply, resulting in tissue or organ damage. Rituxan, or rituximab, is the first ever medicine approved by Health Canada to treat granulomatosis with polyangiitis, or GPA, and microscopic polyangiitis, or MPA, two severe forms of vasculitis. Rituxan, in combination with glucocorticoids, offers the first approved treatment option for people suffering with these diseases. Dr. Eric Riche, director of the Rheumatology Postgraduate Training Program at the University of Montreal, says the approval of Rituxan is a development that will advance patient care.
Granulomatosis with polyangiitis, or Wagner's disease, and microscopic polyangiitis are rare diseases which pose a significant challenge because we don't know much about them, and the treatment options are not very numerous. Traditional treatments may work, sometimes do not, and have serious side effects. So having now new opportunities like Rituxan, we can now offer patients and their families significant advance in the control of the disease, and we may reach remission.
GPA and Mpa are considered orphan diseases because they are so rare and relatively unknown or understood. In Canada, GPA, for example, affects about 1 in 20 to 30,000 people. Presenting symptoms of GPA and Mpa can range in severity from chronic sinusitis, skin sores, or severe fatigue to lung hemorrhage and kidney failure leading to dialysis. Both GPA and Mpa have a 5-month survival rate if left untreated.
Patients suffering from GPA or Mpa can fall through the cracks of our health system because the diagnosis is very difficult to make and can be delayed. Once diagnosis is done, it's not very good news as treatment options are quite limited. And the prognosis of the disease itself is very serious, with sometimes even death. So one can understand that patients and families may feel very hopeless about the situation.
The approval of Rituxan is based on the results of the RAVE study, Rituxan in ANCA-associated vasculitis, which suggests that Rituxan is as effective as the current standard of care in inducing disease remission at 6 months in patients living with GPA and Mpa. Rituxan, however, did provide certain benefits. The RAVE study showed that patients with disease relapse responded better to Rituxan than the standard of care, with a greater number of patients reaching the primary endpoint than those not on Rituxan. Rituxan basically helps stop the body's own immune system from attacking itself. This is welcome news for patients like Jacques Ducharme.
I found out that I had this disease 20 years ago. I had been tired for a while. I had nausea, headaches. I could always feel the fatigue in my body. My joints were swollen, and since my wife was always bugging me, I finally decided to see a doctor for the first time 20 years ago. Rituxan brought me a lot compared to the treatments I had before that were still harmful for the body. Rituxan had fewer side effects and gives me the right to believe that I will have a better quality of life. It's a way of seeing things. I mean, I'm saying I have more strength, all my treatments. I'm still sick, but I will overcome this. I can feel it.
For more information on approved effective treatment options for GPA and Mpa to increase chances of achieving remission, speak with your doctor.